My name is Debbie Stark, and I'm the statewide housing coordinator for the Division of Services for People with Disabilities. I would like to talk about housing for people with disabilities. Now, I'm going to use the acronym DSPD throughout the presentation, and that stands for Division of Services for People with Disabilities. The first thing that I tell people is to apply for subsidized housing assistance at the housing authorities. There are housing authorities nationwide. You can go online to www.hacsl.org to apply. The housing authorities have made it possible so that when you, say for instance, you go to the Salt Lake City Housing Authority to apply, on the application, you can check a box to include an application to the County Housing Authority. Now, you probably ask, why would you want to apply at more than one housing authority? The reason is because each housing authority manages their own waiting list. You might have a better chance of moving to the top of the list if you apply at, say, 3 housing authorities instead of waiting on one. Right now, the housing authority lists are very long, and a couple of them are actually closed right now. The Salt Lake County Housing Authority is closed, and the Salt Lake City Housing Authority is closed. But keep in mind, there are housing authorities all over the nation. Housing waiting lists are very long, and it takes patience to wait for housing. Being part of the community and living as independent as possible are among the most important values and goals by people with disabilities. The families and advocates need to, in turn, work with one another to wait their time. A home of one's own, either rented or owned, is the cornerstone of independence for people with disabilities. However, across the U.S., people with disabilities, including people with intellectual and developmental disabilities, face a severe housing crisis. The affordability gap for people with disabilities has exponentially worsened in recent years. According to Priced Out in 2012, over 4.8 million non-institutionalized Americans with disabilities who rely on federal monthly Supplemental Security Income, SSI, have incomes less than $8,700 per year, low enough to be priced out of every rental housing market in the nation. In 2012, the average rent for a one-bedroom apartment was $758 per month, or 104% of the national average monthly income for beneficiaries living independently. The supply of affordable, accessible housing remains far less than the need. Key programs at the U.S. Department of Housing and Urban Development, HUD, seek to increase affordable housing for people with disabilities. In fact, recently the federal government released some funds to Utah to focus on affordable housing creation. The state is working to complete a grant focused on those funds. I hope to hear more about that at a later date. Now, I would like to talk about some of the types of housing through the Housing Authority. Because having housing subsidy is so necessary to be able to afford your rent, it's important to know the different programs that are available. The first one that I would like to talk about is public housing. Public housing is housing that is owned and operated by the Housing Authority. It's not a voucher or a certificate that moves with the person. It is connected to the property. The Housing Authority staff does all the maintenance and management. A lease is signed with the Housing Authority. Usually, public housing waiting lists are shorter than the rest of the waiting lists. The second one I want to talk about is the MOD Rehab Program. They are apartments located in the Salt Lake City that are operated by the Salt Lake City Housing Authority. The apartments are owned and operated by a private landlord, but the voucher given out is connected to the property, not to the individual. So the person would live where the voucher is connected to. Next is Section 8 Housing Choice Voucher Program, where the housing voucher is given to the individual, not the property. The holder of the voucher finds their own apartment, signs the lease with the landlord, signs an agreement with the housing authority. The property owner or the property manager hired by the owner does the maintenance and management. This program is what most of our DSPD clients have because people want vouchers that move with them, and in most instances, they want to choose wherever they want to live. Supportive housing for the elderly and persons with disabilities, project-based. This type of Section 8 is tied to the project. The owner has a contract with HUD, which will pay the owner all of the rent over the individual's portion. The rent would be based on 30% of the individual's income after allowances have been taken into consideration. Because most of issues due to sequestration, housing authorities are making financial adjustments. It might be 40% of the person's income instead of 30%, but they are trying not to have any loss of subsidy for anyone. The housing authorities have been great to work with our DSPD clients. It's wonderful news when people have waited on a housing waiting list for several years and a Section 8 voucher their name comes to the top of the list. The person must then begin to move through the process required to obtain the voucher. This is a critical time. Information would be gathered and orientation will be needed to be attended, and all verifications must be in place before the caseworker can authorize the first housing payment. Now remember, if your family member is on a housing authority waiting list, always update your information. If you move, let the housing authority know. Also, they need to recertify their income annually to qualify for housing. I would now like to talk about some other housing programs. RISE has a Latitude program. It helps individuals develop the skills that individuals need to reduce their dependency on others and let them live life to the fullest. Latitude means freedom from restraints and limitations. Latitude specialists work closely with the individuals to help them learn the basic things they need to find their way around the world. They assist individuals with independent living. Not every individual is ready to move out of the nest and live with a roommate, but after an evaluation, Latitude will assist those who are ready to move either by themselves or with another participant in the Latitude service. Latitude will assist by helping determine which apartments will fit their need and budgets and work with them both to develop a successful and happy independent life. There is a cost for this program. If you want to learn more about this, call RISE at 801-717-2387. Now, many people think that DSPD has a housing program. They do not. They provide residential services, group homes for people with disabilities. Only in the most critical situations are people in services with DSPD ever receive residential services. The reason for this is that the waiver requires that we provide what is needed, not what is wanted. They take into consideration, can the person be maintained at home? And if not, then we will look at other alternative ideas. Now, I'd like to talk about intermediate care facilities, ICF/ID. An ICF ID is an intermediate care facility for persons with intellectual disabilities. These facilities are privately operated and provide 24-hour residential care programs, including a variety of services that are based on the needs and requirements of each individual. Intermediate care facilities provide training, medical, dietary, psychological, and social needs of the individual with the goal of helping individuals to reach maximum potential. Some of the services include day supports, behavior consultation, personal assistance, and medication monitoring. They also provide personal budget assistance, supported employment, residential habilitation, transportation, and training for family members. Some ICFs have 80 beds, and others have a single-person bed. Who is eligible for an ICF ID? They have dedicated nurses at the Department of Health who review the individual's complete application to be sure that they meet the level of care of eligibility criteria. The person must have a diagnosis of intellectual disability or other related condition and must require at least weekly interventions by a health care professional. In order for Medicaid to fund services in an intermediate care facility, an individual must meet the financial eligibility requirements for Medicaid. They must be on Medicaid. There is usually not a waiting list, and intermediate care facilities serve all age groups. For more information, call the Utah Health Care Association. The phone number is 801-468-6100. Or you can go online to info@utah.org. Now I'd like to talk about home ownership opportunities for people with disabilities. Home Choice is a home ownership program for Utah residents with disabilities or who have a family member with a disability. The disability must meet guidelines established by the Fair Housing Amendment Act to qualify. Home Choice providers provide low-interest loans through the Olene Walker Housing Loan Fund for up to 30% off of the home's purchase price before any down payment deductions are applied. The Olene Walker Housing Loan Fund is a 30-year second mortgage at a 1% interest rate with no penalty for early payoff. The remainder of the home is financed through the lender of your choice. The program benefits include lower monthly house payments due to a lower overall rate and no monthly mortgage insurance, higher qualifying debt-to-income ratios, and borrowers must contribute a minimum of $500 towards the down payment. Parents can act as non-occupant co-signers for a child with a disability. Now I'd like to read you a letter from Dave Schuster, the program manager of Neighborhood Nonprofit Housing Corporation. Dear Dave, my children and I would like to express our deepest gratitude to the Home Choice program for allowing us the opportunity to own a home. I have been a single parent to my 3 children for the past 10 years. At 8 years old, my oldest son was diagnosed with Asperger's syndrome. The challenges of poverty and single parenting compounded my son's depression and anxiety. The ability to provide my son and my other children a living environment that gave them a sense of security and stability became one of my family's biggest challenges, especially after fulfilling their wish to get a dog. After displaying anxiety while living in an apartment building, I looked to home rental. Unfortunately, this meant that I paid more for less. Many of the homes were in poor condition and had minimal or no insulation. During this time, I was a student at the Utah State University. The decision to return to school was a source of hope that I would be able to provide my children with a better quality of life. Unfortunately, even after earning my degree, my salary would still not be enough to purchase a home. I saw my son continue to struggle with anxiety, and his depression worsened. My heart ached the few times he asked if we could buy a house. I knew I had to persevere. I focused on furthering my career. I had been working in the mental health for the past 3 years and am currently a social worker. I am very grateful that this program's focus is to help families with a member with a disability. Thanks to the Home Choice program, I was able to tell my children that we could afford to buy a home. The home we were able to buy is twice the size of the rental, with a backyard for our dogs, and my monthly payments are the same. The program has made an incredible difference on the quality and outlook on life for me and my children. Thank you for giving my family the opportunity to live the American dream. Now, interested persons should call the Home Choice Hotline, which is 1-866-493-4500. Or for specific questions, you can call Dave at Neighborhood Nonprofit Housing Corporation. Dave Schuster's number is 435-753-1112, extension 104. Another nonprofit housing program is Habitat for Humanity. Habitat houses are said to partner families at nonprofit and financed with affordable loans. Habitat is not a giveaway program. In addition to down payment and monthly mortgage payments, homeowners invest hundreds of hours of their own labor, sweat equity, into building their Habitat house and the houses of others. How are families selected for the program? The affiliates Family Selection Committee chooses homeowners based on their level of need, their willingness, to become partners in the program, and their ability to repay the loan. Habitat for Humanity advocates for affordable housing and wants to eliminate homelessness from the world and to make decent shelter a matter of conscience and action. For information on Habitat for Humanity, go to www.habitat.org or call 801-263-0136. Another subject on housing that needs to be talked about is how to find housing for the disabled. There is a state website that I found to be very helpful. As statewide housing coordinator for the Division of Services for People with Disabilities, I receive phone calls daily of individuals looking for apartments for people with disabilities. The website is http://findhousing.utah.gov. The person that is over the state website is Laura Reese. Her phone number is 801-468-0091. The website, Find Affordable Housing, is provided as a public service by the Utah Division of Housing and Community Development, Utah Housing Coalition, and participating affordable housing developers, agencies, and managers. I'd like to now talk about tax credit properties. I have a list of tax credit properties that are apartments where the apartment complex receives a tax credit if they set aside so many apartments to be rented as affordable. If anybody is interested in this list, I would be glad to provide you with the information. My phone number is 801-538-4146. I want to touch a little bit on disability rights in housing. Whether choosing to live in private or public housing, federal laws prohibits discrimination against persons with disabilities. It is unlawful for a housing provider to refuse to rent or sell to a person simply because of a disability. A housing provider may not impose different application or qualifications criteria, rental fees or sale prices, and rental or sale terms or conditions than these required of or provided to persons who are not disabled. A housing provider is required to make reasonable accommodations for persons with disabilities. A reasonable accommodation is a change in rules, policies, practices, or services so that a person with a disability will have an equal opportunity to use and enjoy a dwelling, unit, or common space. A housing provider should do everything he or she can do to assist, but he or she is not required to make changes that would fundamentally alter the program or create undue financial and administrative burden. Reasonable accommodations may be necessary at all stages of the housing process, including application, tenancy, or to prevent eviction. An example would be a housing provider would make a reasonable accommodation for a tenant with mobility impairment by fulfilling the tenant's request for a reserved parking space in front of the entrance to their unit, even though all parking is unreserved. Federal law requires housing providers to allow persons with disabilities to make reasonable modifications. A reasonable modification is a structural modification that is made to allow persons with disabilities the full enjoyment of the housing and related facilities. Example of a reasonable modification would be allowing the individual or the person with a disability to install a ramp into a building, lower the entry threshold of a unit, or install grab bars in a bathroom. Reasonable modification usually made at the resident's expense. However, there are resources available for helping fund building modifications. Additionally, if you live in federally assisted housing, the housing provider may be required to pay for the modification if it does not amount to an undue financial and administrative burden. If you have any fair housing questions, you can contact the HUD office. Michelle Hutchins' email is Michelle, M-I-C-H-E-L-E, Hutchins, H-U-T-C-H-I-N-S, @hud.gov, or call the Disability Law Center if you feel there is a discrimination, 801-363-1347. Individuals looking for affordable housing should also continue working with caseworkers, housing authorities, and homeless agencies to take advantage of their expertise and contacts for any housing questions. I would be glad to assist you as the housing coordinator for the Division of Services for People with Disabilities. My phone number is 801-538-4146, or my email address is dstark, S-T-A-R-K, @utah.gov. Thank you so much.